Anthropometry, designed by Alphonse Bertillon, began in 1890 and lasted approximately 20 years before being replaced by fingerprint identification. Alphonse's father, Louis Bertillon, a famous French physician and anthropologist, largely influenced Alphonse's knowledge and interest in the human skeletal system. Alphonse Bertillon proposed a method of identification in 1879 using anthropological body measurements. With help from his father, he was able to successfully develop and implement anthropometry in 1882. In addition to physical measurements, Alphonse recorded physical descriptors of person. For example, the hair and eye color, including any unusual markings on the body, example tattoos and scars. Lastly, Alphonse included frontal and side view photographs of each person, which we recognize today as mugshot. At this time, fingerprinting techniques were being developed for comparison purposes. Bertillon resisted the use of fingerprints and clearly favored his own method of identification. However, he was the first European to solve a murderous Kiefer case using fingerprints in 1902. Significant errors in the Dreyfus case 1894, the Will and William West case 1903, and the theft of the Mona Lisa painting 1911 largely contributed to the dismissal of anthropometry and the wide acceptance of fingerprinting. The images in this extraordinary album of forensic photographs were made by or under the direction of Bertillon. It was probably assembled by a private investigator or secretary who worked at the Paris prefecture. These two French words meaning speaking likeness, portrait parle can be defined as a rigorous system for verbal description of physical characteristics of the subject. It is based on the Bertillon method of criminal identification by measurements of the human body, and is still in practice today to some extent. A distinctive description of every feature of the face and head are especially valuable for investigation, especially when a set of the suspect fingerprints is not available in his life. The history of portrait parle in 1882, Alphonse Bertillon, also called father of scientific detection, said that anthropology could be invoked to aid in the sight recognition and identification of criminals. Employing these methods of scientific description, he worked out a system of identification utilizing 11 skeletal measurements, which are practically unchanged after maturity and are not affected by increase or loss of weight. Alphonse Bertillon, 1853 to 1914. And 25 traits described in Bertillon card. These are follows: gender, face shape, chin shape, skin color, hair type, curly, wavy, straight, widow's peak, color of eyebrows, eyebrow thickness, eyebrow placement, eye color, eyes distance apart, eye size, eye shape, eyelash length, mouth size, lip thickness, nose size, earlobe attachment, ear pits, hair ears, cheek freckles, forehead freckles, and hair color. And this is the sample of Bertillon's card. Forensic odontology is proper handling, examination, and evaluation of dental evidence which will be presented in the interest of justice. Knowledge of forensic dentists requires encompassing of number of disciplines, since the dental records obtained can identify an individual or afford the information needed by the authorities to establish identification of the case. Kaiser Nelson defined forensic dentistry as that branch of forensic dentistry that, in the interest of justice, deals with the proper handling and examination of dental evidence and the proper evaluation and presentation of dental findings. Dental identification plays an important role when identification of remains of deceased person is skeletonized, decomposed, burned, or dismembered, and is invalid by visual or fingerprint methods. And odontology is a science of teeth. Odontologists study how they are structured, how they develop, and how the various diseases that affect them. The term forensics means of or having to do with questions of law. Forensics odontology is the application of an odontologist's work toward the legal sphere, such as in criminal cases. The scope of forensic odontology: the first one, identifying unknown human remains through dental records and craniofacial bones. The second one, age estimation of both the living and deceased. The third one, recognition of analysis of bite marks found on victims. Number 4, analysis of orofacial trauma associated with person abuse. Number 5, determining the gender of an identified individual. The 6th, eliciting the ethnicity. Number 7, assisting building up a picture of lifestyle and diet of skeletal remains. Number 8, analysis. So here's the dentition. There are 32 teeth, 4 tooth types: the incisors, canines, premolars, and molars. And orientation are the size and root structure. So this is the incisor and canines. And this one is premolar and molar. So we're going to the bite mark investigation. To recognize the bite mark, if a pattern the injury is not detected or recognized as a bite mark, the entire investigation is preempted because the forensic dentist will not be notified. So forensic odontology is the application of dental science to legal investigations, primarily involving the identification of the offender by comparing dental records to a bite mark left on the victim or the scene, or identification of human remains based on dental records. Forensic anthropology can be described as the analysis of human remains for the medico-legal purpose of establishing identity. Anthropologists are routinely called upon to assist in the identification of individuals whose remains are severely decomposed, burned, disrupted, mutilated, or otherwise rendered difficult to recognize. Their services have been of particular value in 3 main areas. The number 1, investigation resulting from homicide, unexplained natural deaths, accidents, and mass fatalities. The number 2, non-criminal events resulting in multiple deaths, example, arising tropes. Number 3, war crimes investigations and genocide. However, the anthropologists may also be called upon to assist in the assessment of the living, providing confirmation of identifiers such as chronological age for the purpose of judicial accountability, immigration, or asylum status. Human anthropology and human identification. The role of the forensic anthropologist focuses on applying a detailed knowledge of the development, morphology, and variation of the human body as an aid to establishing, confirming, or indeed refuting personal identification. The stages of forensic human identification. In practice, the anthropologist may not always be able to identify bone fragments to a particular species, but they should be able to determine whether they are human through macroscopic or microscopic evaluation depending on the elements of the skeleton presented for identification and the degree of fragmentation of the bones. By examining the skeletal remains, an anthropologist can estimate whether they are from a male or female. A skeleton's overall size and sturdiness give some clues. Within the same population, males tend to have larger, more robust bones and joint surfaces, and more bone development at muscle attachment sites. Pelvic differences between males and females. However, the pelvis is the best sex-related skeletal indicator because of distinct features adapted for childbearing. The skull also has features that can indicate sex, though slightly less reliable. Male skull and a female skull. Determining how old the person was when they died is much more difficult than estimating their sex. The estimation of age at death involves observing morphological changes in structure in the skeleton. In a female costal cartilage, there is close-up shows dense nodules of trabecular bone, and in the male costal cartilage, there is close-up shows crab claw appearance of trabecular bone. The detection, identification, classification, and study of various bodily fluids such as blood, semen, saliva, urine, breast milk, vomit, fecal matter, and perspiration, and their relationship to a crime scene. Generally is comprised of the detection of enzymes and antigens as in the identification of seminal stains or blood typing, ABO, and secretor status, and DNA typing. These are the serology section of forensic laboratory. Number 1 is blood typing, characterization of unknown stains, blood spatter analysis for crime reconstruction, paternity testing, semen identification in sexual assault cases, DNA typing for identification of victims and suspects. So this is the question to be answered by the investigator. So this is the presumptive test for blood determination. Question to be answered is it blood? Number 1 is the Castle-Meyer test. A mixture of phenolphthalein and hydrogen peroxide, the hemoglobin will cause the formation of a deep pink color of blood is present. The second one is the leukomalachite test. A mixture of leukomalachite, green, acetic acid, and distilled water is placed on the sampler. The second one is the leukomalachite test. A mixture of leukomalachite, green acetic acid, and distilled water is placed on sample. Then a drop of sodium perborate added will turn blood a greenish color. For luminol, it is for large area of blood. Presumptive test mixed with hydrogen peroxide, and during the reaction with hydrogen peroxide, the luminol is oxidized and light energy is released. And for unknown stain at the scene, question to be answered, is it human blood? Matitrace yung human blood through microscopic observation. There are 4 components or main components of blood: the plasma, white blood cells, platelets, and red blood cells. DNA fingerprinting is a laboratory technique used to establish a link between biological evidence and a suspect in a criminal investigation. DNA fingerprinting is a laboratory technique used to establish a link between biological evidence and a suspect in a criminal investigation. Micro and mini satellites galore. DNA satellites were first identified by biologists in the 1960s and come in two types, microsatellites and mini satellites.